everybody, this is Dr. Caridi from the Austin Gynecomastia Center, and we got a nice video today. We do a lot of videos, we have a ton of videos, and I know that you guys love these videos, and they're educational in nature, so that's why we put them out. Developed this nonsense when he was a kid, right? So from my perspective, my first reaction is, he has gyno, obviously not a big deal. I don't sweat this, okay? I can treat the chest. What I try to concentrate on is the rest of him. So he's a big boy, and in the college ranks, they like him big. The problem is when you finish college, you got to deal with life, right? And so that just means that being big is not as cool, and a lot of that stuff turns into fat, blah, blah, blah. But anyway, the moral of the story is this. I'm a huge fan of weight control for none other reason that I'm a physician and I got to keep my patients happy and healthy, right? That's really what it's all about. So, and as anyone knows me or sees me on the internet, I don't mince words. I mean, I love you dearly, and I want everyone to love me, but I'm okay telling you what you may find hard to take sometimes. And sorry, but that's just the way it is. All right. In his case, he's already lost some weight before he came here, which is a wonderful thing, and he's going to lose more weight. Now, the great thing about treating his chest is once we get rid of this nonsense, he's going to be totally motivated to even get in better shape. All right. So that's actually what I call the positivity of hooking in what's going on up over here with everything else. So we know we all struggle with weight, including me. I'm no different. But how do you get the motivation to lose weight? It's really tough when you get gyno. I mean, it's just tough. I mean, you don't want to go to the gym because it looks weird. You can't really wear shirts no matter what you do. It really doesn't seem to change, right? So it's sort of a demotivation. It's like an anchor in life, right? I mean, it's just...
Yeah, I ain't had no problem. It just feels weird, you know, with guys having their shirts off, and you're just like, I feel like a sumo wrestler.
Yeah, like those big sumo wrestlers. Yeah, and it's okay to some degree, but it's really not that cool. I mean, so it's just not that cool. All right. So anyway, let's move along. So basically, you know, we have the classic zones. We got zone 1. Zone 0 is here. Okay. You may have some gland, but you know, we'll see what happens. And remember, this reminds me, you don't necessarily have to have a gland. And the diagnosis of gynecomastia, once again, folks, listen good, is the appearance. It's not about feeling it, or it's just how it looks. This is not normal. This is just not normal. This isn't flat like a normal chest. All right, so this is zone 1 up over here. We're going to fix that, okay? Now, if I just did this and didn't treat this, this wouldn't be too cool. So what I'm going to do is I'm going to come up in here. I'm going to get zone 2, okay, which is this stuff right here, hand down. And then he's got some of this fullness right here in 3, all right? And I know the zone system, it seems whatever, but it actually works. Now, what's really interesting in his case, he doesn't really have a zone 4. I mean, zone 4 would look like it's like a big area of fullness here and here. I mean, obviously he's got some fullness, but the thing is, it's not any different than the rest of his abdomen. It's all uniform. So it's not like I'm going to have to treat this to make it blend in here. I don't have to treat this much at all. What he's going to do is he's going to lose some weight, and this is all going to go away. Treating these zone 2 and 3 here just gives him that nice sculpted look of his upper chest, okay? His muscle comes in like this, if you will, and goes up into his arm. That's what controls your arm, your chest muscle, all right? So we're going to see more of his muscle. This will all be flat. This will actually look a little bit bigger, obviously, because when we're done, it's just going to be a proportional issue. So temporarily, it's not a big idea because guys can have bellies, but they really can't have boobs. That's just not the way it works, right? So we're going to get all these zones. It's going to be mostly fibrofatty tissue. He's got good skin. This is going to go back. And he's well on his way to kind of a whole new kind of deal. So it's actually really exciting what we're doing today. We'll show you just the routine way I treat the gynecomastia. He doesn't need to have a lifting procedure. He doesn't need to have any incisions around his areola. Standard treatment. If there's anything that I've kind of brought to the world stage, it's that 99% of people with gynecomastia can be treated with the way I've done it in my videos. And you don't need to have scars in your chest and all this other kind of nonsense, okay? So if at the very least your surgeon suggests that you need to have skin removal and scars, or maybe scars around the areola, please get a second opinion. Oh, heck, just go to my website and you get a virtual consultation and submit it, and I'll just tell you what I think. But it's pretty uncommon. If you have a weight loss in your breast down here, yeah, you're going to have that removed. But in most cases, no matter how big it is, it actually will go back nice. And he's young and in great shape anyway. Anyway, so that's the story. We're gonna catch you up in the back soon, and we'll kind of show you what we do. There. You see what the problem was? You look different. You lost weight.
Yeah.
How much weight did you lose?
I don't know.
He looks
I'm at
totally different, doesn't he?
265.
That's amazing. I mean, you look totally different. But you get the idea. This is what you're doing here. You're putting your shoulders back, but this is where you're curved in the back. So now you're sitting up nice. Look at that. So this is sort of like the ultimate test in gynecomastia, right? So it's a nice, sit nice. Okay, so he's got a nice chest. Feel that, man. This is freaking amazing. So let me see the picture. Nah,
That was not me.
that's not him. This is not. Is this Kyle? Are you serious?
No, that was not me.
That's not him. We're deciding whether or not this is him or not. And he's denying that this is him. It's like, yeah, it's got to be him. No, he's like, my nipples are different. No, that's him, right? Well, guess what? We got this mole to go off of, right? And these three, right? So, okay, do it. Take it off. Wow, nice. Totally nice. Wow. That
Now
is.
he's got a tattoo now.
Ooh, that is bad. That is you. Look at this, folks. This is cool. So there's that mole, there's that mole, there's that mole, and there's that. So this is him. Wow. So that is cool. Oh boy, that is really cool. All right, so let's just hold this here and let's kind of go over this for a minute here. So look at the fullness over here that was lateral to his nipple. What do you see here? Nothing. Nice sculpture, lateral edge of the muscle. You can see the big bulge up in the lateral over here. That's pretty much gone. This is his pec muscle now. You can see the nipple areolar complexes are smaller, much more normal in size, actually completely normal for him. And there's no puff ditty or no nothing. You notice it's a little darker because when this contracts and gets smaller, it's like a pond and it's more concentrated. So the pigment cells are more concentrated. I can see he's got a new addition over here, which is interesting. This is all nice. Flex your muscles. Woo! Okay, so you can feel that's his muscle under there. He's all muscle now. This is pretty much a home run, wouldn't you agree? So just to reiterate what we did. So you can imagine all this area here. This is the meat and potatoes. Okay, so this is zone 1 here, and that has all the gynecomastia tissue, and that's what made this nipple puffy and all this kind of stuff. So you can imagine concentrated on this, and you can see he has extra skin and it's kind of saggy, right? So we always worry what's going to happen with that skin, but as you can see, you just saw it went down. But you got to remember here, look at all this stuff here, okay? Zone 2, all right? And then the fullness that he has up on here, which is zone 3. And so you can see a real nice improvement over that. So his muscle sort of is in this area down to here, and then it kind of comes across here, and it goes up into his arm. Okay, so that's the big pec muscle. So once we've reduced all this tissue that hangs up here, this nipple has gone north to a higher level, right? And you can take that off again. Let's take a look. His nipple's gone north as the skin retracted, and you can see in this area here, he's more V cut, right? So look, so this is more of a V cut. His lateral border of his muscle is here, inferior border is here, and look at the nipple is way above the border, right? So you can see here his nipple is just about a little above, but now it's way above, and it's shrunk down. And then the funny thing about this as well is like, okay, so where's the scars?
Like right there.
Yeah, like right there. We need a magnifier glass. So when I tell patients that this is scarless surgery, I mean, technically there's a scar there, I guess, here. Okay, it's harder to see, and he's still not even long out. There's another one up over here. I try to put in the hair, right? You know, it's not a joke. It's actually the reason why we do it. You know, surgery is just surgery, and Kyle basically said if you can afford it, get it done, which is real, right? I mean, because it costs money, and we understand that, and we all wish everyone can afford it. It's tough, and we got you, but there is light at the end of the tunnel, and if you can sort of muster up the resources to get this done, it's a life changer, obviously. And so you don't have to get it done right away. Remember, it's a condition that's not going to kill you. It's not even unhealthy. It just gets into our head. So the damage is really mental more than anything, and it stops your lifestyle and all this kind of stuff. He has a nice result. He can be proud of it. We strive for beautiful results on everybody, and it is art, so that's really kind of cool. So, I mean, the fact that he puts a tattoo on would draw attention to his chest, that just says it all.